you are aware, emergencies do happen. Emergency medical services are required almost all the time. Now, our constitution, the national constitution, is the right to health care, which is section 76. And in that section, there is a portion or a section that says every person, not just a citizen, not just a permanent resident, but every person has a right to emergency medical services. And what you are seeing today being demonstrated is our capacity as a nation to provide emergency medical services. Before patients are taken to hospitals or to clinics or to the nearest health facility, there is care, emergency care that is going to be provided. And I'm sure you might also have heard of what the concept of golden hour. That if you get into an accident scene or a patient has been involved in an accident, they need to be looked after, taken care of, and be attended within an hour. And if that does not happen, usually the mortality rate goes up. It means that hour of care, of emergency care that is required is the kind of services that you are seeing being demonstrated and exhibited here today. We have a lot of our ambulance services that you have seen here that are exhibiting the kind of services that they are providing and so forth. They are mostly the ones for the private sector. That's the ones that came here today. But we also have a lot for the public sector. We saw one from the city of Harare, which is public sector, and so forth. But they are showcasing the kind of services that they are able to give before the patient reaches a medical institution to then be seen by the experts in the hospital. And that care is very, very important. And as you may all appreciate, all human beings die. But this care we are providing is to prevent premature death, premature dying from issues or from causes that we can prevent. If a patient is just bleeding, we can stop the bleeding and the patient will be safe. So these services you are seeing that are being provided by these companies and these ambulance services, they are there to stop premature deaths. And that premature death, it's a time-dependent process. If you don't take care of the patient, if the patient does not have oxygen in their brain for 4 minutes, that patient is dead. Even if you resuscitate the lungs, you resuscitate the kidneys, the heart, but the brain is gone. And if you resuscitate the body without the brain, there is no human being to talk about. So that time is very critical. And that's why we talk about the golden hour. But in reality, if you don't have oxygen for 4 minutes in your brain, you're dead. If you don't have sugar, we call it sugar, but it's glucose. If you don't have that glucose, the brain does not have glucose for 8 minutes, that brain is dead. Even if you do everything and you resuscitate them, you resuscitate all the organs, that patient is technically dead and just waiting to be buried. So this is the importance of the services that you are seeing being executed here. We need to assess and see capacity, our capacity as a nation to provide medical emergency services. What you did not see here today, which I thought they should have also brought, is the air evacuation. The helicopters, they also have fixed wing planes that can take patients from here to neighboring countries, and that kind of stuff. And with the Ministry of Health, we actually have 3 bases of our helicopters that are doing air ambulance evacuation. base at Sabino Gabe. We have a base at Kawuko International Airport in Hawaii. 2 ambulances, 2 helicopters there, 2 helicopters in Salim Gabe, and we have just opened another one in Victoria Falls with 1 helicopter, and we want to open another one in Mashingo very soon, so that it can also cover even the Eastern Islands and that kind of stuff. So all those are emergency services that we have to provide our patients before they reach the hospital, and that increases the survival rate and naturally, eventually, the lifespan of Zimbabweans, because we want to see the lifespan of Zimbabweans rising from 65 to levels which other countries are enjoying. If you go to Japan, they enjoy 85 years of life, that kind of stuff. But if we don't have these emergency medical services, it means our people are dying young, you see, and our longevity also goes down. So in a nutshell, these are the services that we provide that you are seeing being executed. They also provide a lot of training services in the process, training citizens, training students. They even go to kindergarten to train those little ones how to do a first aid, that kind of stuff.
What do you say?
Right, these are emergency services, emergency medical services. As I say, in our constitution, there is a right for every person to be attended to in any medical emergency situation. So all these ambulances you see here, regardless of whether somebody can demonstrate that they can pay the medical aid, they should, by law, attend to the patient first, and then issues of payment can be done later. In fact, just I think yesterday, the Medical Services Amendment Act, which incorporates that right that was provided for in the Constitution, which is now law, as from yesterday, it's now law. It means if an ambulance refuses to take care of an emergency medical situation, they can be prosecuted in our jurisdiction now. So it's all these, if they are called for an emergency, they should respond. That's the legal position in terms of the law now. So it's very important for us to know, even if in the rural areas, the helicopters I was mentioned, those helicopters are actually lifting people in far and remote areas of Zimbabwe, and they do it for free to the patient. And as I speak, those ambulances, since they started, they've airlifted more than 2,000 patients. And we are talking ordinary Zimbabweans being lifted in an emergency situation to a medical facility and to be taken care of. And these ambulances are expected to provide a similar type of service. Payments arrangements will be done after saving human life.